So I know this was addressed a little bit in your in a prior session where
Mhm.
so the criteria and so forth for substance use disorders were outlined, and what it really boils down to is not just substance use, but is there impairment related to that? Are there distressing or upset feelings associated with it, and is there sort of a difficulty controlling that use over time? That can exist along a continuum. So one of our very first things that we do for kids that we have a question about how substance use is fitting into their lives is we do an assessment. We get to know them better. We get to understand not just their substance use, but also other things that are important to them, other things that are going on in their life, so that we can have a complete picture and not just focus on maybe the one thing that got them in trouble,
Yeah.
or the one thing that is really causing a lot of conflict. But we are going to talk about their substance use. And so if it seems like that's really not a factor and it is experimentation, we might offer some guidance. We might offer kind of a brief sort of conversation to help them not escalate beyond that. But in cases where substance use does sort of rise to the level of a substance use disorder, we start with that evaluation, and treatment programs, at least on an outpatient basis, tend to fall into two categories. One is very focused on the family. Again, really underscoring this notion that parents, caregivers, other family members have a really important role to play in helping kids reduce their use, stay safe, and start engaging in other sorts of behaviors instead. Other types of interventions are a little more focused on the teen themselves and help with not only building their internal or intrinsic reasons for reducing their use or making changes in their substance use, but also equipping them with the skills and strategies needed to continue to not use over time, to stay safe, and really, be in a strong position to pursue their other goals.